Good morning. Welcome to Saturday Morning Coffee. I'm Lance McKinnon, as always. And today is a very special day. We have a fantastic guest on who has over 2 decades of medical experience in the cancer industry. And I'm not going to steal her thunder at all because we all know that I am not a physician. The only way I am a physician is if I go on Google and Google all my symptoms, and we know I have a lot of symptoms.
Don't do
Um,
that.
but no, but today I just want to put a disclaimer out there that today's conversation is a very close conversation to myself, and it should be to everybody listening, as we're going to be talking about cancer. Um, and just one fact known that 1 out of 2 people in America will have cancer at some point or will know somebody with cancer. And Tiffany is actually going to be, Dr. Tiffany Troso is going to be speaking to us from the medical side of it. I know we've had a lot of guests on here, Saturday Morning Coffee, with their testimonies of them surviving cancer, but this is the first time ever that we've actually had somebody from the medical industry to speak about the basics of cancer and what everybody goes through. And again, I'm not going to steal Dr. Troso's thunder, but good morning, doctor. How are you?
Good morning. How are you?
I am fantastic, and welcome to Saturday Morning Coffee. And I know it's Saturday. You got your medical coat on because I know that you're constantly working all the time, and even on Saturdays you're working. So I am absolutely excited, and sad in the same way to have this conversation, but it is a conversation that we must have. And what you're doing is something brand new, and, and I'll let you go ahead and tell us a little bit
Yeah,
about yourself and where we're going with everything.
sure. Again, thank you for having me. I'm thrilled to be here. This is a new venture for me, and I would call this actually my passion project. I just to introduce you myself a little bit so everyone has some background. My name is Tiffany Troso-Sandoval. I'm a medical oncologist. I've been in practice for over 20 years. I subspecialize in breast and gynecological cancers, including ovary, uterine, vaginal and vulvar cancer, for example, cervical. Medical oncologist is somebody that gives the chemotherapy and who often will serve as what I call the point guard. So after patients have had surgery, they come to the medical oncologist for further treatment, whether it's chemo or hormones or targeted therapy. And I usually at that point will take over sort of surrounding care and make sure that they need to see radiation or surgery again or to any other subspecialties. I'm the one that would help to distribute that care and to oversee it. So the reason I'm here and the reason that I am so excited to be able to speak to all of you is because I have found over the years, and increasingly so, that patients are not well informed and they're not educated about the cancer process, about what is going on, why they're getting the treatments that they are, what their choices are. And my mission right now is to help educate and empower patients and their family members so that make their cancer journey more tolerable.
That's absolutely wonderful. I know that you and I have had a lot of in-depth conversations, and people are probably wondering, well, who is the doctor that everybody sees, and it's you.
Yeah.
And I just want to touch base on this, that it's a very tough subject, and but what is it like for you as a doctor to be able to or have to deliver this news on a daily basis?
Right. So, there's a couple of ways I can answer that. I can tell you that most patients, once they've come to my office, already know that they have cancer. I'm the one that usually will help define what stage it is or how it's going to be treated and what the process will look like going forward. It's a tough road. It's a very tough road. And but I enjoy being able to help people. And the one thing I always, I remind myself is that I didn't give them cancer. but God gave me the power to help them. And so that's what I'm here to do.
Yeah, very good. And thank you very much for that answer because, I was thinking about it after we have talked and met, and I was like, man, you have to do this day in and day out. And, my heart goes out to every family um, and caretaker that has had cancer, myself included. I don't really talk about, a whole lot
Hmm.
about my medical history, but
Right.
Dr. Troso knows, my medical history, and it's very tough. And there is a lot of support out there. And one of the things that I really enjoyed about when we first spoke, and maybe you can go in depth to it, is um, we talked about the basics of cancer.
Hmm.
There's such a wide basis of cancers out there, names and that we can't pronounce or I cannot pronounce.
Hmm.
But we talk about the basics that you want to do in your project here to help
Hmm.
families and caretakers understand. Can you just tell us a little bit more about that?
Absolutely. Thank you very much for bringing that up. So, again, that is one of the reasons that I got into this, was because it's been astounding to me how when patients come in, they don't necessarily know their diagnosis, or if they're coming from another physician, they don't know what treatment that they had. Patients don't know the difference between a CAT scan and a PET scan, or what stage of a cancer it is, and what that means, what the difference is between chemotherapy and immunotherapy. So it's part of my mission to help define all of these very basic things and bring them to a level where the layperson, non-doctor people, really understand. And I spend a lot of time with my own patients in my own practice doing this. And I think it really, really helps people. It really helps patients to understand, so that they're not running to Dr. Google, so that they're not trying to figure out what Dr. Troso was talking about. I want them to hear it from me. I want them to understand. So I'm actually in the process of creating a Facebook group that will collect people that are interested in this type of an education. And I have written an online course that I will be releasing shortly. And I'm also in the process of writing a book. It's
Oh,
going
you
to
are
most
writing
likely,
a you're
I
writing a book
am.
as well
I'm
too.
writing a book. I am. So Cancer 101 was taken. So it might be something along that lines, but essentially that's what it is. It's Cancer 101 from an oncologist explaining to a patient and to their family members what it is, what all of these words mean, what all of the process means.
Yeah, and I'm glad that like I said in our previous conversations, I'm glad that we're going back to the basics because um, it can be overwhelming. It is
100%.
overwhelming when you're diagnosed with cancer of any sort. For as a patient or as a family member,
Hmm.
our minds, battlefields are won and lost in the mind within 6 inches, and immediately we go to worst case scenario.
Hmm.
And I'm glad that you are there, doctor, to be able to break down the basics, for the caretakers to help them understand.
Sure.
How receptive are they to your information once you meet with them?
Well, of course, there's always stress and emotion involved with, hearing the prognosis, if that's what we're discussing, or what the treatment plan is going to be. But of course, most people are there to learn and to be helped, and so most people are very receptive to my recommendations, and how I present them to them. I spend a lot of time giving patients tools in which they can use to help empower themselves. So, for example, very, very simple thing. Patient comes to the doctor, they got chemotherapy, it was 3 weeks ago, I haven't seen you, and they come in and they say, I was really nauseous. Well, that's terrible. I'm sorry you didn't call me. Let's see how we can fix that for the next cycle, the next treatment. And so, well, when were you nauseous? Was it right after the treatment, or was it a week later? Or, so I ask specific probing questions. And patients don't remember necessarily because they just didn't feel good and they don't know. And then the sister is sitting there trying to, well, was it after Christmas or was it the day after? And so, I found that frustrating for the patient, but also for myself, because the more information I have, the better I can help you. So I have now taken upon myself to make sure that all of my patients buy a calendar. You all have to buy a monthly and a weekly. It's monthly and weekly.
Yeah.
And I should have brought one with me, but at any rate, the purpose of it is, on the monthly side, you're going to put in all of your appointments that pertain to cancer. everything. So it's all there on one page, all your chemo, your radiation, your doctor's appointments, what have you. And on the weekly pages, you have these nice big boxes. And I want you to journal. I want you to mark for me, how many glasses of water did you drink? Did you move your bowels? Were you nauseous today? Did the medicine work or not work? Et cetera, et cetera. And I'll give my patients things that I want them to record for me. Then they bring me the book. And then I can go through that and say, okay, so 2 days after chemotherapy, you were very nauseous. So, okay, there's a way to manage that and I can fix it. But if I don't know where it was in the cycle, it's much harder for me to manage. Does that make sense?
Yeah,
So it's just
absolutely.
such a basic concept and such an easy tool, but people don't use that. And so I think every patient should have that book. And I'm actually in the process of writing an app that will be even
Oh,
more
okay.
powerful. Wouldn't
That's
that be
wonderful.
great?
Yeah, that's going to be great. You already spoke that into existence. I mean, you're writing a book. I mean, you're doing an app.
I
But
don't sleep a
no,
lot.
no, you're like myself. You like to really stay busy, and
Yeah.
and this is really important that we go back to the basics of this. And you would have thought that, you have over 2 decades in the medical industry, working in cancer, that nobody has ever thought of, hey, we need to take a step back in order to move forward
Hmm.
in the world of cancer. And what kind of gave you the foresight to do that?
So I'm a clinician. I'm an academic clinician. I see lots and lots of patients. I enroll lots of patients on clinical trials, and I have been, like I said, been doing this forever. Because of who I am, I really get to know my patients because I feel that the more I know them, the better I can help represent them and make decisions with them. Because I need to know, yeah, every person has different sets of morals and values and what's important to them. And I've just watched the struggle over the years of people trying to keep control over their situation or their life in a very uncontrollable situation, right? So you get cancer and you can't control that, but every person feels better if they have some control. And so I try to empower my patients to control the things they can control to make them feel better. So, very basic, again, going back to basics. If a patient drinks enough water, eats enough protein and calories, sleeps well, moves their bowels, and gets out and walks every day, that patient's going to do 100 times better than the patient that doesn't do that.
Yeah.
So, I try to, and those are the things you can control, right? Those are the things that are within your power. And so, again, it's all a matter of trying to, handle patients' expectations and also empower them to help themselves.
Yes, and thank you for answering that. And just, so for our followers and our listeners out there, Dr. Troso, she has over 20 publishings in the medical field. So this isn't just, your average everyday cancer doctor. She's very accredited with over, I think I had that number correct. I
Yeah.
believe it was 20, 22
I don't
published
know. I don't
journals.
count them.
And, I counted them for you, and so I was running out of fingers and toes, So, but no, so you're very accredited with all the information that you are providing, for our audience to out there, and so I'm really excited that you are deciding, and you have a Facebook group that
Hmm.
you are creating,
Yep.
that people with cancer, is it just people with cancer or caretakers as well?
Caretakers as well. Caretakers as well. And when you go to the Facebook page, which is Winning the Cancer Journey, you will be asked a series of questions just so that I can make sure that you're not trying to sabotage me or you're not an alien from Mars or something. But although I guess you could probably lie and make up the answers, and I probably would admit you anyway. But yeah, it does ask you, are you a patient? Are you a caregiver? And then, it's really, and then there's, just the rules of conduct, like be nice to each other, that kind of thing. But I'm amassing this Facebook group because I want to have, a solitary platform that I can release information to in a field of people that are very interested in hearing it. So I also, obviously I'm on LinkedIn as well. And I'm developing a few other things as I had mentioned, but that's primarily where I'm focusing right now is my Facebook group.
That's wonderful. And also too, you will be adding an additional text number as
Yeah,
well.
yeah, yeah. Yes, yes, yes.
I know, I'm going to try to make sure. I'm going to dig a lot of things out of you, doctor. I got my journal, and I've been writing everything down in my journal, and I just want to make sure we're dotting I's and crossing our T's.
Sure.
But again, we're laughing and we're joking, but what you're doing is such a godsend, and I'm truly thankful for you, and I'm sure that a lot of people are will be as well too. Cancer is one of those taboo conversations, elephants in the room, sort of
Hmm.
thing. Like I said, our hearts goes out to all those who have had it, those who have lost family members and friends. I know. So, like I said previous to it, this is a very touchy subject. So I don't want anybody
Sure.
to think we're making light of it. Um, but
No, no, no.
but that is the conversation that we need to start having more of. And with cancer, it brings along the other elephant in the room is the mental health aspect of
Hmm.
it. Can you
Hmm.
speak a little bit more about the mental health aspect of a cancer patient?
I can honestly tell you it runs the gamut. We have, and you can look at it psychologically in terms of how patients will cope with stress and, you know, difficult positions. And so some patients withdraw completely. Some patients become actually very angry and aggressive. And some patients become very intellectual about it. They start intellectualizing things and start trying to learn everything that they can, and can actually be quite challenging to the doctor because they've done a lot of research. And so they want to understand what they've learned versus what you're telling them, um, and everything in between. I have a lot of depression. There's a lot of anxiety. Anxiety is probably the overwhelming emotion that we deal with in the clinic on a daily basis. And it's part of my job, and I've been very well trained in how to peel back those layers to get to what is bothering them, or what their concern is. Because at the end of the day, when a patient comes in and they're angry or accusatory because you didn't call me back fast enough, or I didn't, my CAT scan, I didn't get to see it, or whatever it is, they're upset because of the disease and their situation and their fear and their anxiety. And it's very important as a physician to be able to kind of look past all of that and help the patient and meet them where they need to be.
Mm. Oh, very good, yes, and that's what I was saying because that it does bring on a gamut of emotions, and
Absolutely.
and the first one is fear, and what am I going to do next, and
Hmm.
is my family going to take it, and
Right.
like I said, and is there a section of that in your journal that you will add as how the patient is feeling as well too, as well as I know we talked about, well, I feel nauseous on such and such day, but
Uh-huh. Uh-huh.
is there an emotional aspect in your journal that you'll have for the patients as well, or is that something you haven't thought about?
I never thought of having them journal on a daily basis about their emotions. I'm not opposed to it. I'm not opposed to it. I just often, sometimes, if you can imagine in a 20-25 minute consultation with your doctor, that yes, I want to know how you're doing, and I do want to help address the emotional aspect of it as well. But if I get lost too far in that, then I am not really able to help them on the medical side as well. So it's something I address, I acknowledge, and then I usually try to help them seek more support. And so I'm very fortunate that my nurses are excellent listeners, and I have a social worker and a psychologist that works with me. And so it's not that I'm not interested. I very much am, because I have to meet the patient where they are. But oftentimes that would need to be almost a separate conversation, because helping the patient with their psychological aspect or outlook of where they are right now, what's provoking their anxiety, what is leading them to not be able to get out of bed because they're so sad. There's a lot to that. It's not a topical conversation,
Mm.
especially when you're clearing them to go to chemotherapy in 20 minutes or so. So it's something that I definitely will talk about that with my team and see about how we could best capture and note that type of information. I can tell you I definitely assess it at each visit because it's important. But I don't know that I've been tracking it on a daily basis like that. Maybe that's something we need to look at though.
Oh, yeah, because I know that most people who have diagnosis with cancer, the first person they get upset with is, the darn doctor did this. They don't understand me here, and I think you hit the nail right on the head. Is now they're not really mad or upset with you,
Mm,
as the doctor. You're giving them information. You're the messenger.
right.
They're mad at the diagnosis of it.
Hmm.
And
Hmm.
so I know that you don't take it personal. So maybe that's kind of a little PSA. Unfortunately, with all of us who suffer cancer or caretakers like that, maybe we should be a little bit more easier on the physician that's taking care of us. Because at the end of the day, you really are the messenger.
Right.
And
No, it's
he was
true.
to a very unfortunate diagnosis. And so, maybe we can figure out a way to tone back our temperament towards the medical field.
Or just realize that, nobody goes into oncology because they're looking to make $1 billion. I mean, I am here because I want to help people, because I love the science and I love helping people on a very deep level. And that, at the end of the day, no matter what transpires between, I'm here. And I tell my patients this all the time. I'm here to help you. I'm here to help you however I can. There's nothing about our interaction, or even, if they want to go get a second opinion or what have you, it's not me. It's not about me or my ego or my personality. It's all about the patient. I'm here to help you, right? And so whatever that takes, then I do. Um, so I, you know, but it's hard. You can imagine, layers and layers of education and experience and what have you. And it's hard to always try to bring yourself back down to what are we doing here? I'm here for you, and I'm here to help you and help guide you through your journey and hopefully cure your cancer. And, I think it's very good, especially if you have a good rapport with your doctor, to be a teammate with them.
Yes, very true. And again, I cannot thank you enough for what you do. And it's tough because, you know, when you walk out of one room with one patient, uh, whatever that may be for 25, 35 minutes, in one situation, you have to close that door, put your notes in, and you go right back into another case.
Yep.
And you do this every day, day in and day out, and you've been doing this for over 20 years. And God bless you.
Oh, thank you.
I mean,
Thank you.
that is a heart of a servant right there. That God is completely using you in so many different ways. So I can't commend you enough for what you do. And I guess as a patient, we don't see that. And so that's why I was really excited to have somebody in on the medical aspect of it. Again, I've
Mhm.
had a lot of gentlemen on, Brian O'Sullivan and Tim Sloan and Mark Kagamu and Liam Ryan.
Mhm.
A lot of patients that I've actually done a podcast where Brian O'Sullivan did his last chemotherapy, from the chair.
Really?
Um, yeah, and
Was that at my hospital?
yes, it was.
Oh, wow.
I don't know if we got approval from it from legal or not, but we went ahead and we did it anyways. And but he wanted to showcase, what it's like to go through, the chemo aspect of it.
Sure.
And then, like I said, we've had a lot of testimonies, from people
Mhm.
with that survived, and fortunately, we've had some people on that have not survived. And there are a lot of cancer groups out there. I know Mark Kagmu has To Be Your Own Hero, which is a great safe place for cancer patients to go to and talk. And that's he has a YouTube page. Tim Son has a weekly podcast
Mhm.
as a perspective on cancer. And these are two very close individuals that I deal with on a weekly basis, monthly basis.
Hmm.
I know Tim's actually having a live in-person
Hmm.
event coming up here, a 2 day
Yep.
um, in Honesdale, Pennsylvania, and it's great because you're bringing in a lot of individuals who have survived cancer. Unfortunately for Tim's cancer has come back.
Mm.
Um, After so many years, and he's such a warrior, and but he's persevering, and Mark Kagamu, he um, his cancer treatments were just unprecedented, and so these stories of cancer patients who are meeting weekly, um, and caretakers as well too, are we meeting weekly on a podcast, just to tell their stories
Right.
and testimonies. But I know from speaking with Tim and Mark that we've never had a doctor on, uh, to tell the perspective of it. And
Sure.
so, which is really interesting. And I know that Mark and Tim are going to be really interested in having a conversation with you, Doctor, as well as their followers and so forth. How is it received? I want to say, ask this question. How are you perceived by other oncologist doctors for your project? Are they really receptive behind this? Is it something they want to get behind? And, it's like, do you have a large group that's like, hey, let's do this? We need to go back to the basics.
So because I'm early in my project, I have not necessarily shared it with my home school, so to speak, but I can tell you that I've had an enormous response from other oncologists around the country, and I people applaud it. And I found that people are very grateful because, again, we all agree that if the patient understands and feels empowered to have a conversation and to understand the conversations with their physician, they're going to do better. They're going to feel better mentally, and they're going to, be able to participate in their care. So it's been actually very rewarding so
That's
far.
good. That's good. I know. I now going back is I'm glad that everybody's behind you on that, and because so forth. Because I really think that this is something, like you said, this is very brand new, and I think that the rate of stress in the medical field is really high. And
Hmm.
I want to talk about Dr. Naomi Batiste. She has created what is called the metaverse. She's called the metaverse doctor.
Hmm.
And actually, she was on Saturday Morning Coffee, and she actually created a metaverse world just for doctors alone, to create a hidden identity, to go into a metaverse world and to be able to communicate with other physicians throughout the world, without underlining who they are, to help them on a stress level. And Dr. Batiste, like I said, she had me create an avatar, which I wasn't used to. So, but it was very interesting, and
That is interesting. Yeah.
yeah, and I want to put that out there. And she's really the first of her kind to
Hmm.
actually create a safe place
Hmm.
for physicians to be able to go to. And I believe she's now
I have to
allowed.
look into that.
Yeah, and it's great,
Yeah.
because of the stress level, that physicians are under. People don't realize, like we talked about, you're dealing with cancer patients, and and you've won some and you lost some, and it takes its toll on you, at the end of the day. And so I'd be amiss not to mention uh,
Yeah. Thank you.
Dr. Batiste and the metaverse and the doctor. Yeah, it's a Norma Batiste and the metaverse doctor is what she calls herself.
I'm absolutely going to look it up. I'm
And
writing it down.
it's really a safe place for physicians to go to release stress.
Exciting.
Because yeah, you're like, I am there tonight.
Spell
And
that.
yeah, and and the great thing about it is that I don't know how well you are, obviously much more advanced than me, didn't create an avatar, but it's really something wonderful. And I know that she holds workshops as well too, just for doctors as well as patients, to be able to come in. And a lot of people are afraid um, to talk about it, and they're like, well, I have cancer, and I have all these questions, but I don't know where to turn to. And here's another PSA to all my followers out there: is just open up your mouth, and just start talking. Again, between cancer and mental health, these are conversations that we no longer can be afraid of, and they need to be talked about. As scary as they are, they're impacting our world uh, in an increasing amount of numbers. And just saying, um, the fact that 1 out of 2 people will be diagnosed with cancer or know somebody who has cancer is very scary, very alarming. And so, um, people just talk about it. I mean, what would your advice would be on this, doctor?
On what exactly?
On just being able to say, hey, I have cancer, and speaking about it amongst your friends.
Huh. Well, what I have heard, and I feel terrible about this kind of persona, but I've heard people have shame about having the diagnosis of cancer, like they did something wrong, and that's ridiculous, and that's never how the doctor at least would ever look at it. I don't see my patient walking in and say, "Oh, it's your fault. You didn't take good enough care of yourself," because I know better. I know that everything in life and everything in cancer and medicine is a combination of environment and genetics and unfortunately luck at this point. So, I absolutely encourage patients to reach out and, talk to their friends and their family, gather all the support that they can, and to make sure that they find a good doctor that they can work with, because it's very important that you can partner with your physician. And if it doesn't work, then ask for a second opinion. As
Mhm.
I've always told my patients that, second opinions, it's not personal. This is your life. This is you. I want you to feel comfortable with my recommendations and my, procedures that I have laid out for you. And if that means going and asking somebody else also, that's it. That's fine. They should do that. Unfortunately, if you do get a second opinion and even a third opinion, you run the risk of having 3 opinions then, and they might not all match. And then you have a difficult choice of trying to figure out which one is the best one for you. Doesn't mean you shouldn't go for it, but just mentioning that, you can, I've seen patients end up with quite a dilemma over that
Mhm.
kind of a
Yeah,
thing. But
and I'm glad that you brought that up, because that actually was my next question for you. And sitting on with Tim San, on the perspective of cancer, that
mhm,
meet every Tuesday at 3 p.m. And that's for anybody and everybody. So again, you just can log on to LinkedIn and find Tim San, SOHN, and the perspective of cancer, and just listen to some of the stories. And
mhm,
one of the conversations that always comes up is that second opinions.
mhm,
Should I get a second opinion? Should I get a third
mhm.
opinion? And like life in itself is, I still remember my math grade teacher, Mr. Peeler. Um, the old KISS method. Keep it simple, stupid. Uh, you
My
know.
soccer coach used to say that. That's one of my favorite
Was he
phrases.
named Mr. Peeler?
No, no, but he was awesome. He was awesome. He coached me from fourth till 12th grade. He was fantastic.
Yeah.
Mr. Anderer, shout out to you, Mr. Anderer.
Yeah, so shout out to Steelers. So yeah, I've always kept that model, and again, we're not making light of it or anything else like that, but
No,
it is
no.
good to get, like you mentioned, a first or second opinion. But sometimes our brains are going so fast,
Hmm.
and we're trying to take in so much, and we're thinking, what if this, what if that, and if we cloud it up with too many opinions, like I said, from your institution, which is a highly recommended institution, versus another institution, which is a third, so now you have 3 opinions from 3 highly accredited institutions. Um, now you've really clouded up the highway. And so, and you have to think what is best. And so,
Right.
I think that's very important that you talked about. It's
Sure.
okay. I mean, so as from a
It's more
doctor,
than okay. It's
from a
expected.
doctor's
It's
perspective,
recommended.
yeah.
Yeah.
So you do recommend your patients to see a
I'm
second.
frequent, because of where I am and the type of disease that I see, which is fairly, breast not so much, but gynecological cancers are not as common. I am very frequently the second opinion. And it's like I said, that's where I started this whole passion project of mine, because it was amazing to me when the patients would come to me as their second or third opinion, and they still didn't really understand. And I would spend as much time as it took to make sure that they understood and that they, really could comprehend and figure out or understand why I was making the recommendations that I did. And I think it's very important. I think that, having the second opinion, like I said, it is very helpful, but and I do encourage it. But then you end up, as we discussed, maybe two or three different opinions. The fact of the matter is, though, if say that you see somebody from the East Coast like me, and then you see somebody from the West Coast or the South, you might get two opinions that are both correct, that are both, they're not wrong. They're both correct. And so it might be like a regional style, believe it or not. And so, this happens a lot. For years, this happened in breast cancer. Where I am, we'd offer, or recommend one particular regimen up front. And you'd go to another institution in Texas, and they would recommend a different regimen because that was their group favorite. And, they've been compared and contrasted from different clinical trials. And at the end of the day, they're probably both as equal in terms of response rate and what have you. And so then you really have to spend time with your patient to understand what their priorities are. So, for example, believe it or not, there are patients that will decide not to get treatment whatsoever if they're going to lose their hair.
Oh, really?
There are, absolutely. And so, there are ways around that. We have certain cooling caps that we can use, but up until recently, that wasn't covered by insurance. And so now it's starting to be covered by insurance, which is great. But, certain chemotherapies can be manipulated. How you give them might change the outlook or help change this symptom profile. And so sometimes you might be, comparing A and B, and efficacy wise, they're the same, but they have different symptom and side effect profiles. And so again, you have to go through all of that with the patient and make sure that they understand and help them decide which one is the best treatment for themselves. So
That's very good. And you did bring up, and I know that again for our patients and caretakers too, is you brought up healthcare. And so it's unfortunate that it's out of your control
mhm.
that I just want to, our people listening is that unfortunately not everything that is recommended uh, for the patient is going to be covered underneath healthcare.
No,
Uh,
don't
so
even get me started.
yeah,
Get me
unfortunately,
started.
I know you and I have already had an in-depth conversation about some of these things as well. Me, personally for myself and some family members and so forth like that.
Sure.
But we have to remember, you're trying to give the best results out there. Get the best results for your patients. And I know that again, the patients get mad and be like, "Why does the doctor recommend this for me?" when it's not covered by healthcare. And it's, unfortunately, it's the
Yeah.
world that we live in, and I don't know how we can ever change it. So if the government's listening, please, whatever clinical trials are out there, for cancer patients, I urge you, just accept it and, and let everybody be healthy. And because it's bad enough that the patients are dealing with this illness, but they're also weighted down with there's this only medication that has been provided to me, from Dr. Torso that's not being covered, and
Right.
and that puts you in a dilemma.
Actually, you know what? Actually, even more frequent than that, because we usually stay within, general guidelines of what's FDA approved or NC National Cancer Network approved. The bigger problem that I see is actually it is covered, but the copay is astronomical. So it's covered, but you're in, whatever donut hole, or you haven't met whatever deductible, and it's going to cost you $3,000 a month for the copay, right? And so that's infuriating, right? So it's covered, but it's not, the copay is astronomical. And so we have, with a lot of work, and we have case managers that help us with this, and good rapport with the drug companies. There are a lot of different drugs that we can get for the patients on compassionate use, or with some sort of a philanthropy type of an aid for them. And so it is actually fairly unusual for me to not be able to somehow get the drug in some shape or form for my patients, but that's partially me. I'm kind of like I don't give up.
Yeah, no, I know. Just from our conversations, I see that, I've heard that, and and everything. That you are very determined to get what you want, which is absolutely great.
Mm.
But the one question I do want to ask you is that I do hear this weekly, on the perspective of cancer calls, and and to be your own hero, and Brian's journey with Brian Sullivan, that was at your institution, was that how do you feel about holistic care?
Mm.
Because you know I hear, I've been on both sides of the spectrum, obviously, without going into details of my own
I'm gonna
personal.
squirm in my chair a little bit here. Um,
You know, so
Actually, you're
I've
gonna
been
be
on both
surprised.
sides of the spectrum
Yeah.
here, of of the medical aspect of it versus
Mm.
the holistic, and and I hear a lot of testimonies, where people say, I'm going to go holistic and versus medical, and there's doctors that are completely against holistic versus. Um, this is how it's going to be, and I just want to get your take on it. I'm not going to hold your feet to the fire on it. I know this. It's. I already made you squirm. I might be in trouble after this
No,
call.
no, 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 no,
So.
no. Don't be silly. I'm actually so let me define what you mean by holistic. What do you mean by holistic? Because
uh,
that matters a
uh,
little bit here.
Herbal care. Taking more
Herbal.
herbal. Yes, more
Okay.
herbal.
So my feeling is that, and again, coming from years and years of experience, that there are no cancers in this world that are going to be reliably treated or cured with herbs. They're not. I know you're going to find one in a million cases and somebody it worked for, but there were probably other factors involved. I am actually probably one of the more liberal oncologists in terms of I actually do believe in a lot of supplements. I think that there's a role for supplements in terms of helping to augment the patient's immune system to help fight off certain side effects to the chemotherapies. I do think that you have to be very careful about what you're taking and why you're taking it, because most of herbal supplements, for example, have not been vetted out versus the chemotherapy, right? So let me give you an example. For years, everybody thinks, antioxidants are so good for you. They're going to help get rid of free radicals and help prevent cancer and heart disease, what have you. So people are taking very, very high doses of vitamins that'll help to get rid of free radicals, right? So those are the A, D, E, C's, right? And there have been studies that show that actually taking very high doses of vitamin C actually can worsen your cancer. There have been studies that show that taking high levels of antioxidants will counteract your chemotherapy or your radiation therapy. So we often will tell our patients not to take those medicines or those vitamins during chemotherapy, because for better or worse, until our world gets to a place where we're not using chemotherapy anymore, we have to kill cells. You have to kill some cells to get rid of the cancer at this point. And so my purpose at this, now let me back up a little bit. I'm an allopathic doctor, meaning I went to Cornell Medical School. I learned, traditional allopathic medicine. There is osteopathic medicine, which I can almost liken to functional medicine. And I think that at sometime in my free time and at 2 o'clock in the morning, I'm going to start doing a functional medicine course, because I do think that there's value there. I really do. It's just like being a Democrat or a Republican, right? Nobody's completely right. There's somewhere in the middle. And I would like to learn about the other side a little bit more. And I do. I learned quite a bit about it. So, for example, most of my patients are on magnesium supplements, and I make sure all my patients have adequate vitamin D levels. And if not, they're on a supplement. And I do that throughout chemotherapy. But I don't have them on IV vitamin C drips because I know that that'll interfere with the efficacy of some of the treatments that I'm giving. I do think that a lot of the holistic methods can be complementary, but you have to be careful again that you're not counteracting what your oncologist is trying to do. And my final thought is that I feel that a lot of holistic methods are probably best served in the maintenance phase. So let's kill the cancer, let's get you in remission, and then let's do everything that we can to prevent it from coming back. So, like I said before, I don't think that anyone's going to cure their cancer with vitamins and herbs. That's my professional opinion. But I do think that there are certain supplements and ways to augment your immune system and your general health after treatment that might help prevent the cancer from coming back. So that's my stance on it.
Well, thank you for clarifying that. Is because I know that is that clarifies things for myself. Like I said, I'm being on both aspects of it. But like I said, I hear it weekly. On the support groups that I'm involved in, and it's like, so you gave a
Can I
very
interrupt?
yeah.
I'm sorry to interrupt, but I just want to just augment that point that you just said, that you hear it weekly on the support groups that you're on. And I think that it circles back to the point that I had made earlier, that patients are seeking a way to control their environment, to control their cancer care. And a lot of these vitamins, you can go on, a million different websites and order them and take them yourself. You're taking control. That is a way for patients to take control. And whether or not it's well-founded or backed by science is not even the point. They're taking control. So I think that's an important, realization for patients, is that, they're looking for control over their disease and their situation.
Well said. I couldn't have said that any better. And that's very important to be able to take control of your life and to not just sit back and wait. Because, like I said, there are things that you can do. One of the things that I believe in is like, get out there, exercise, watch your diet, take some herbals. That, there are things that you can do instead of just kind of sitting back and just saying, hey, I'm going to take a pill and wait for this pill to kick in. Unfortunately, you do have to put some work into it yourself as well, if you can. From a patient standpoint. And doctor, I know that. What?
Just make sure that you're discussing that with your doctor so they know what you're taking.
Yes, and that's why I wanted to get your opinion on where you stood on it, because I know that there are some oncologists out there that are completely against it, and then you might find a patient saying, "Well, my doctor's against it, but I heard Jim, Joe, Bob down the street that is working for him, so I'm going to try this." And so, again, from a doctor's perspective, in order to be able to treat your patient at 100% accuracy, you need to be open and honest and say, because in your mind, in your medical opinion, you're like, well, this should be working. But if they're taking something that should be working, but yet you're not telling your doctor that you're taking something else that might counteract it, it's going to leave your doctor kind of at a miss, because, again, it's all about that patient-doctor relationship. And
so I'll tell you a quick story. So it's not too long ago, maybe a couple of weeks ago, I had a patient who was on curative chemotherapy, and all of a sudden her liver function enzymes, the enzymes that are released from your liver that we measure every week to make sure that you're healthy and what have you, no reaction to the chemotherapy or to some of the anti-nausea drugs. So we do her blood work every time she comes in. All of a sudden shot up to the sky. What's going on? I was terrified. Did the cancer spread to the liver? What, does she have hepatitis? What happened? So so then she goes through a battery of tests. They sent her for a CAT scan, have, hepatitis panels, looking for viruses, what have you, gets ultrasound. Anyway, so all that comes back normal. And then I finally said, all right. And I learned my lesson not to ask. I have to ask this first. I did ask her, are you taking any new medicines? And she said no. But she'd started a whole vitamin regimen that her brother had sent her from Alaska. And she didn't tell me about that because she doesn't consider those medicines. Right. So
Okay.
now I said, all right, so fess up.
Yeah. Here we go.
Let me see them. So then, her sister runs back to the house, brings in this bag of, medicines the brother shipped from Alaska. And I'm looking through and I'm like, oh, okay. Well, this is going to interfere with X, Y, and Z, and your liver is really upset right now. And you have to stop this. And for goodness sake, I mean, she missed, 2 weeks of chemo because I didn't know what was wrong with her liver, and we're working that all up. But you got to be honest with your doctor. And, you also have to make sure that you're not doing any harm to yourself. And, not everybody knows. Everybody thinks everyone's an AAD, almost a doctor, right? So,
yeah.
it's like,
I said that earlier.
Right.
If I can Google it and find it on Dr.
Right.
MD, I'm a
Right.
doctor.
Right.
That's like I stayed at the Motel 6 last night. So I'm almost a doctor.
Exactly. So, you just got to work. You got to have a good partnership with your doctor. You got to talk to them and really, so.
Yeah, so thank you very much. And again, I just want to recap, like you said, your Facebook group, the Winning the Cancer Journey, and
Yep.
that's coming out. And we're going to make sure that's in the bio, as well as
Sure. Thank you.
your textful. I didn't talk about the number. I'm going to put the number in. I think it's 844-464-5613. And,
Right.
you can be able
And you
to
text winning.
text winning.
Winning.
Yes,
Right.
because we're going to win today over cancer. Cancer loses. We win today. And doctor, I know that it's Saturday and you're working and you're taking time
Thrilled to be
away
here.
from your patients to educate us from the medical aspect of it, which is I think is going to be very helpful, for a lot of people who are going to be receiving this news or have this news or they're suffering as long as with caretakers. So I imagine that you're going to be getting flooded with phone calls. And, I know that God is watching over you and your heart and your family as you embark into this journey. I just want, I can't thank you enough. And I just know that you're going to touch so many lives and just, people listening to this podcast is going to set so many seeds to people that, now they're going to go and have these conversations with their doctors. They're not going to be afraid to have it. And so, again, so I was really excited, to have it from a different perspective. We've had a lot, like I said, a lot of testimonies of survivors on here, but having it come right from, like I say, cliche, the horse's
mouth.
The horse's mouth.
Did you just call me a horse?
Yeah, no, I didn't call you. You're a winning horse. You're gonna win the triple.
Yeah,
the triple crown. Come on.
So. But let me also just mention, I don't know if I told you this before. So, but once you sign up for my Facebook group, I will have you enrolled in the group, and I have a free giveaway for everybody. I'm going to give you a PDF on the 8 most important questions to ask your oncologist, and I think that will be, and that's free, obviously. And I think it'll be very helpful to a lot of patients, especially if you're new, but even if you're not, because I think that making sure you know everything on that checklist is really empowering yourself.
Oh, and I do want to ask too, just from my own personal, is there a way that you'll be able to take donations for individuals who cannot purchase these books as well too? Because I know that a lot of people are going to be, not going to be, but are going to be like, well, as you really mentioned, some of these co-pays and so forth like that, and so forth like that. But will there be a way to like say, hey, I can call in and say, hey, I want to donate X, Y, Z for whoever may want the book. but can't afford it at this certain time.
I'm sure that you and I can talk about this. I haven't gotten that far. I'm at a Facebook group and a free PDF at this point. So when I get to the
I'm running a marathon here. As I said, I'm the horse. I'm like, you better catch up with
I'll
me.
have to check back in with you.
Yeah.
Can I come back? Can I come back?
Yes, you can absolutely come back. You can come back as many times as you want. We're getting together because I think we're going to have a whole other segment with a different family member from your family we didn't even touch on. Uh,
Oh,
I believe I might give you a little small hint. His name might be Tyler, and he has the same last name, but we're going to be looking at it from a different, whole different conversation
oh
from
my.
from an athletic point of view, and I'm really excited about connecting with Tyler as well too. And I see your face glowing, and he's doing absolutely amazing things, and you're
Yeah,
such a
that's a
proud
good point.
mom, and as well as you should be. And
Thank you.
I know that Tyler and my son are connecting, and but we don't want to give all the spoilers away today.
Of
And
course.
um, one of the things I do want to mention before we sign off and you get back to seeing patients, I know that this is something you and I talked about. Um, we're on the cuffs or heels of Breast Awareness Month.
Mm,
October. We're in September now.
yep.
This podcast will be airing here relatively shortly. But I think you and I personally feel that, 1 month dedicated to breast awareness is, not a cliche,
Right.
but this is a conversation that should be held 11 months out of the year,
I
or
agree. Absolutely.
365 days a year. I'm glad that, we take the time as a society to, recognize it, for the month. Um, but, with you working in, 2 decades in breast cancer and GYN cancer, I think that this is a 365-day awareness
I
of
agree.
cancer.
I'm
And
working on it. I'm working on it.
we're working on it. We're doing our part.
Yep.
And Doctor, I thank you very much for your time and
Cheers.
opportunity. Cheers to
Salute.
Saturday morning. Salute. There's no, I got my Fifth Acres coffee in here
Nice.
from Good Brothers Cafe. So I have to make sure you get some of that. And we'll have to get you a t-shirt too. And, yeah,
Need a
yeah,
t-shirt.
yeah, well, you know what? You can be my co-host, and I won't have to change the T-shirt.
There you go. There you go.
So we can just rock it. And sorry, Tiffany. You
The
just
other
been
Tiffany.
the
Right.
old the old
Yep.
Tiffany 1.0 has been replaced with Tiffany with 2.0. No, we can't do that.
I don't want to be the other woman.
No, 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 no. There'll always be Tiffany 1.0. And, it's just, it's very unfortunate, she's not able to be on this podcast today. And I know that she would have a lot of great insight just because of the field that she's in as the director of home dialysis for
Mm,
DaVita. So she has that medical background as well too.
hmm
So I know that she was kind of bummed out that missing this, but I'm sure that she'll be in contact with you, and I know that you'll be back on the show, presenting again as your Facebook grows and your book comes out and the texting and so forth and everything,
Woo.
and we will always keep our guests and followers updated on how to find you and
Perfect. Thank you.
like that. And I just want to say God bless you for
Thank you. You too.
all your service and what you're doing. And I know it's tough and it's difficult, and so it's difficult on both ends. And so again, cheers to everybody who is fighting cancer, who has won cancer, and who's lost cancer. But today we win. Cancer loses. And thank you very much, Doctor, for being on Saturday Morning Coffee today.
Salute. Thank you so much. Thank you. I'm honored.
Salute, and I'll talk with you soon.
Bye bye.